Danielle, I mean, when someone comes in and they've been told, say by an orthopedic surgeon, that they need a joint replacement, what are some criterion that you use to determine that somebody actually is a good prolotherapy candidate versus like they really should right away go for a joint replacement?
Well, usually when patients say, oh, I was told I need a total hip replacement or a total knee, they have a set of x-rays that I always do want to look at if they have them, because a lot of times patients are told that they're bone on bone when they really do have joint space. There's kind of, that's really subjective, depending on who looks at the x-ray. But one of the biggest things I want to look at is their range of motion. If someone is told they're bone on bone and they need a joint replacement, but their range of motion is fantastic, they're going to likely be a really good prolotherapy candidate and avoid that surgery because their motion is so good.
So say for the knee. So say for the knee, like what are you saying? Like when you say their range of motion's pretty good, like so what are you looking for?
If you use my elbow as my knee, like they can really get almost full range of motion. If someone comes in and they were, they're bone on bone or what have you, and they're told they need surgery and this is their motion, then maybe that is probably what they should do. But if they've got good range of motion, even if it's a little limited, but it's really almost there for the most part, they've got some tender spots on ligament and tendon attachments, maybe even some creaking in the knee, some grinding. Usually they do really well actually with Prolo.
So anybody at home, whether it's a shoulder, a hip, or a knee, even if somebody's been told they need a joint replacement, if at home, like they could literally compare their non-painful shoulder with their painful one, or their non-painful knee with their painful one, then if the range of motion is basically the same, just that in and of itself, they're most likely going to be a very good prolotherapy candidate.
Right, it's a good prognostic indicator, absolutely.
And not need. And then the other thing you said that if they have tenderness around the knee. Mm-hmm. So what does that mean? So you're examining them, or they're just poking on themselves like their knee or their hip, and they have tender spots. What does that mean?
Well, right. So again, kind of using the knee as an example, obviously, like I said before, you have ligaments on each side, and then you have various muscles that attach around the knee as well. So if you are poking, if you feel the bone and you kind of poke on that structure, and you're like, oh my gosh, that does really hurt. Well, that's a sign that there's some kind of degeneration in that tendon or that ligament. If you then take your healthy side and you press and you don't get anything, well, that's also a good sign. Okay, something's definitely needs to be addressed on this side because it's really painful when I push pretty hard here, but this side, I've got nothing.
It is like we talk about the enthesis, or the places where ligaments or tendon attach, and I think some people don't realize when you have tenderness, like to palpation, those are actually structures outside the knee. So, or outside of the joint. Mm-hmm. So it means that if you were just going to get like a stem cell procedure inside the knee, it's not going to address all those places outside the knee. Okay.
If we can look here a minute, Dr. Hauser, this knee, which he just addressed, this is actually the inside of the knee. This is where the cartilage is, okay? And that's what many doctors will give a cortisone shot into the joint. And what Dr. Hauser and Danielle, and we're trying to address you, there's a lot of structures here. From the medial collateral ligament, there's a coronary ligament here, and these are tendons, okay? And there's many muscle tendons that will come down here also in these structures that we will address. So it's much more than just bringing an MRI to the doctor. We're comprehensive prolotherapists. We're physicians who examine joints. And one thing I wanted to kind of go back on that, Danielle, with you, which was really good. Sometimes you have to look at the person you're treating. If you're treating a 20-year-old athlete, okay, versus someone who's 70 or 75 years old, they're not going to have the needs of a 20-year-old athlete. Right. So even if they don't have perfect range of motion, even if you just improve a little bit of their stability of the joint, they're happy because they're not going to be a marathon runner like the 20-year-old will. So it's really good. Motion is excellent, but it's not the total picture.